And a very warm welcome to SDIG Global Conference 2025. SDIG's Global Conference this year is focused around beyond boundaries, building bridges in education, wellness, and AI for transformative growth, amongst several other subjects as well. Your hosts for the next few hours will be Dr. Joseph Nwaye, the president and founder of SDIG, and Dr. Karen Walker, who has been an SDIG stalwart for quite some time. Dr. Walker is an IOP specialist, which stands for Industrial Organizational Psychology, which means she's very clever. It also means that she's extremely good at organizing things, which is very helpful for all of us here. It's a pleasure to have you joining us. We'll be going through the afternoon in a number of sessions, and we're crossing across all continents of the world with those attendees who are joining us from around the world, and also the panelists who are with us as well. So it is my very great pleasure to welcome all of you to SDIG Global Conference 2025 and to introduce your host, Dr. Joseph Nwaye, President and founder of the Systemic Diversity and Inclusion Group. Dr. Nwaye, welcome.
So our spotlight next is on Dr. Toluwani Elizabeth. I don't know if you wanted your full name in there, Adekunle. And I believe that you are ready. Let us know. And so I'd like to go ahead and bring you
Dr.
on.
Walker.
If Sadly, you.
Absolutely, Dr. Walker and everyone, thank you so much. It's a pleasure to be here and thank you for having me. I am happy to present on some of the work I've been doing, which is exploring how medical mistrust is impacting the uptake of healthcare services. I do have a presentation, if I'm allowed to share that, just to guide some type of visual aid, just to guide the conversation. And I recognize I only have 10 minutes, so I'm going to make this very brief. Unfortunately, I'm not able to share it, and that's okay. But I would like to start off by talking about recognizing the importance of trust currently in this current climate that we are in, and how levels of trust have significantly decreased, especially trust in public health. And so prior to this period, we saw how during the COVID-19 pandemic, people were saying no to vaccination and pushing back against engagement in receiving the COVID-19 shot, which let us understand that we are getting to a place in the United States where people don't have trust in the healthcare system. Well, unfortunately, now we can see that that is indeed a problem with the drastic reduction in uptake of childhood vaccination, particularly amongst parents, just not really racially defined, but really amongst all ethnicities. Childhood vaccination has gone down amongst parents in the South. So we're talking about places like Florida, but we've seen the outbreaks of measles, pockets of outbreaks of measles throughout 32 states across the country. So this makes us recognize the need to really pay attention to trust. What is going on there? Why is there lack of trust? What is the distrust about? What is the mistrust about? And this led me into, considering myself as a trust researcher. What does that mean? So when we talk about trust, of course, trust is one party being vulnerable, the other party, essentially ceding their power to, party with authority. And in this case, a lot of the population will cede their power to the health system. So you cede your power to your doctors because you trust that they have authority on the issue. You cede your power to the healthcare system, your insurance company. You trust that your insurance company will pay the bill when the bill comes through. But what we are finding now is that, that level of trust with physicians, with scientists, even publications about why childhood vaccination should, be considered significant amongst parents, that level of trust is gradually and increasingly decreasing among several populations. So how do we make sure that we as public health specialists are paying attention to this lack of trust in our population? So as a scientist, I was interested in understanding the role of trust in cervical cancer prevention amongst women of color, so particularly Black women. And this is because when I think about cervical cancer amongst Black women, we're seeing that Black women are showing late-stage diagnoses, advanced levels of cervical cancer. So with any health problem, you want to catch it early. But the moment you wait longer, the worse outcomes that we see amongst Black women. So what does that mean? So Black women are showing more late-stage cancers, lower survival rates. So, you go through the chemotherapy, and so your chances of surviving are lower the more advanced the cancer is. I'm going to move my slide a little bit further. Give me 1 second. But also amongst Black women, we are seeing that they usually lack a usual source of care, lacking health insurance coverage, just as a result of structural and systemic determinants of health that already exist amongst this population. We're also seeing that they might have not visited a gynecologist within the past year. And usually when you visit your gynecologist, it's helpful because they can then remind you to engage in healthcare utilization. Have you taken your pap smear? Have you done this or have you done that? And so with that being said, we realize that mistrust in healthcare system is a determinant of pap tests amongst Black women, right? Black women are engaging in pap testing so that they can detect if they have abnormal cancer cells on their cervix. And so we found out that lack of trust in physicians to maintain confidentiality was there. Trust and mistrust influenced the adoption of new cervical cancer screening guidelines, as well as mistrust for insurance companies. Will they pay my bill when it comes through? Establishing the trustworthiness of, healthcare programs and agencies that Black women are operating within. And so when we talk about access, the United States is blessed. We have access. You can walk into any primary care facility. You can make your appointment to get a test. But women are not doing this, we found out, because of many factors, including lack of trust. And so I was talking about trust earlier. We have generalized trust that comes from me just trusting you as a party, or historical trust. My parents went there, my sibling goes there, my church member goes there, or whatever religious institution you belong to. So as a result, I can trust you. So that's more, generalized trust. But we also have historical trust based on historical interactions with these systems. So when we talk about mistrust is not merely the absence of trust, but also just believing that this party is out to hurt you. This party would harm me. So you've heard things like, yeah, they do sell people's organs. Don't put organ donor on your driver's license, because if you get in an accident, they could sell your organs instead of saving you. So that's mistrust, right? Not because I've seen anyone that has happened to, just, everyone thinks it happens. And distrust is really just actively, because of your experience, actively distrusting. So lack of trust because I went through this happened to me. So now I'm taking that experience into the next situation. So with the rest of the time I have, I just want to talk about some of the historical background. So when we talk about mistrust, a lot of people think the Tuskegee study was where mistrust began, but we want to go all the way back to when white male travelers would, describe Black women in African countries, the women they saw, right? They would describe them as savages, right? Their breasts hung down below their navels. You would think they had 6 legs. So already painting Black women as savage. And of course, we've seen some of that discrimination seep into today in 2025. So we may or may not know of Sarah Bartman, who was a South African woman and was transported to France and displayed in a zoo just because of her body parts and in a barbaric manner. And she died as, I want to say as a display in the zoo. So she lived in the zoo and she died in the zoo as, someone that was displayed as different because of her body parts. We also know of the impact of slavery throughout the Middle Passage. They employed surgeons and doctors to make sure that the cargo was well preserved. So doctors were responsible for making sure that Black women, and also just Black men as well, the slaves were well preserved. And physicians would issue certificates to prove their soundness to buyers, that this cargo is sound to be bought. And then coming down into even after slavery was abolished. We have very well trusted institutions that engaged in using Black bodies, the cadavers of Black people to perform experiments. So they had grave robbers would go excavate the cadavers and use them illegally to perform experiments. And these are institutions that still exist today. We've heard of the story of Henrietta Lacks, whose cells were used without her consent and the consent of her family and are still being used today. They finally sued and just finished that case recently, I think in the past 2 years. We see in the media today controlling images of the way Black women are displayed, which continues to perpetuate, experiences of discrimination, prejudice against Black women, such that we're hearing stories of women going in, complaining of pain and not being addressed, their pain not being addressed. I think the most recent grotesque case was the one that occurred in Georgia, where this year in June, where a dead woman had to be made to carry her dead fetus for 3 months because of the abortion law in Georgia. So she was dead, but she was put on life support, such that she had to birth the pre-Emmy baby because of the abortion laws. So I'm going to stop there and then just show you a conceptual framework that I have come up with to study trust, and I will wrap it up here. So here's my conceptual framework for understanding the way trust works. Trust is about power. Right? I don't have power in this context, you have the power. But of course, every context differs. But in the context of the healthcare system, we are trusting people that have the knowledge, the credibility, the letters behind their names, doctor, nurse, whatever, to make sure that I'm okay. But what we're finding now is people don't want to succeed that power anymore, just as a result of different types of, maybe vaccination causes autism, for instance. We hear a lot of conspiracy theories. We'll hear a lot of misinformation and unfactual determinants of health that are impeding the uptake of services. So I propose a conceptual framework for better understanding how these experiences, people embody these experiences, and also going through the healthcare system, discrimination that people have to go through, prejudice, history, how that contributes to whether they trust the healthcare system at different levels. So the macro system, where we have policies, the exo system, right? We have healthcare institutions, your hospitals and different healthcare organizations, the macro system, you one-on-one with your physician, and then you as the individual who is taking care, and how this is a pathway of power and contributing to whether or not we engage in whatever care, in this case, cervical cancer screening, but in other cases, it could be some type of vaccination, breast cancer screening, whatever, prostate cancer screening amongst Black men, colon cancer screening. So whatever that health outcome is that we are looking for. So I just wanted to share really quickly with the time I had some of my research. I appreciate the opportunity. I want to thank the organizers of this conference, global conference. Thank you so much. And with that, I'm going to go ahead and mute myself. Thank you all. I appreciate the time. Thank you.
Oh, wow. Thank you so much. I mean, that's so much. The time goes so fast when you have such great information. If anybody's wanting to hear more about Dr. Adekunle's work, please, all the contact information is in your registration links. We're just so proud to be able to partner with each of our guest speakers and be able to showcase their work and their great presentations today. It's just been very rewarding for me to be able to host each of you as well. So thank you so much for that. I appreciate it. Just excellent job. We're going to move into our third panel session today.